The number of Americans that died from opioid overdoses in 2016 exceeded the total deaths of American soldiers in combat in the Vietnam War. From 1999 to 2016, there was a 1,826% increase in deaths related to opioids in Indiana alone.
Clearly, the opioid epidemic is an extremely serious issue, a matter of life or death. This crisis is present all over the globe, but unfortunately highly prevalent in Indiana.
Anywhere I would have followed you.
This opioid epidemic is specifically talking about the misuse of and addiction to opioids, including the prescription pain relievers, heroin, and the synthetic opioids such as fentanyl. This is a serious national crisis that affects public health as well as social and economic welfare.
The Midwestern region saw opioid overdoses increase 70% from July 2016 through September 2017. Every month, an average of 100 Hoosiers die from an overdose of opioids. Indiana has the 17th highest rate of opioid overdose deaths from any state, but is still one of the hardest states to find treatment in the nation.
Just starting to crawl.
For Indiana, the statewide prescription drug usage rate, 12.2%, is highest for those aged 18 to 25. This percentage is higher than the national rate of 9.5%. More than 21% of Indiana's high school students report that they have taken prescription drugs, which includes OxyContin, Percocet, Vicodin, codeine, Adderall, and Xanax, without a doctor's prescription one or more times during their life.
Not only is this an extremely grave crisis in Indiana, but more specifically to teens. The opioid epidemic manifests itself as two interrelated crises: the abuse of prescription pain relievers and the abuse of heroin. Indiana, aware of this issue, has already put into place several solutions to help decrease the negative effects of this epidemic. Firstly, Indiana has put forth programs focused on informing and educating people that illegal possession of a syringe without a pass from needle exchange programs counts as a felony, to make drug addicts see that what they're doing is not only hurting themselves and their families, but illegal. Indiana has a few of these programs, such as the Grand Challenges program. Another solution that Indiana has put forth to help reduce the deadly opioid crisis is naloxone. This is a drug that can reverse overdoses and revive an individual within 5 minutes. This allows them 30 to 60 minutes to seek medical attention.
Massachusetts is also combating the opioid crisis by limiting the length of first-time opioid prescriptions to 7 days. This is helpful in decreasing the possibility of developing addiction. This could be improved by tracking patients' prescription histories, similar to how prescription drug monitoring programs work. Even though there are already effective solutions to this crisis being implemented in Indiana, there is still room for improvement. Our suggested solution revolves around the concept of doctor shopping, which is when patients travel from doctor to doctor seeking multiple prescriptions for the same drug to bypass prescription length restrictions. Only 20 states have legislation that actually prevents doctor shopping, and we suggest that all states, Indiana included, should adopt this legislation to prevent drug addicts from obtaining substances in this illegal manner.